Hi guys! I'm about to start my third video, and what I'm going to be talking about today is why the heck did I choose the most aggressive option to prevent myself from getting cancer in my future. I know there's a lot of options out there, from observation to the most aggressive, which is the surgery. And since I am young, people look at me like, you're only 25 years old. Do you still have your life ahead of you? Are you sure you want to take this route so fast? Are you rushing into it? But I stick by my decision 100%, and I'm going to let you know kind of what my thought process was that made me ultimately come to this decision. And I think it's very important. It's my thought process. Other people might have different opinions and different views on this, but in this case, I just want to let you know that this is my experience and this is kind of what was going through my head. Before I get started, I did see that a lot of you guys made donations and bought some t-shirts from me and Kevin's video with the BRCA t-shirts. That's awesome. Thank you so much. Most importantly, we did forget to mention in the video, I really wanted to get out there that a portion of the proceeds of the money that we raise is going to go directly to a cancer patient to help them out in their difficult time right now. Cancer is no joke. It really sucks. I've watched my mom go through it. I'm a nurse and I've taken care of patients with cancer, and it is the most horrible thing ever. And it is a difficult time to stay positive and to have high spirits, and people really need that support to move them forward, to keep them going, and know that they're not alone, that we're fighting for them too. We're always here for them. And that's the most important thing, that they cannot give up. We cannot give cancer a chance. So it's very important. You guys, if you want, I saw you guys sharing the video. That's awesome. Get it out there. Get it out in the community. We're also raising awareness, letting young girls know, to what this BRCA gene is, and if if they want to get tested early, that's great. Then they can catch, know what their options are in the beginning instead of finding out in the long run the hard way. So that's really just what we want to do, is to educate, raise awareness, and like I said, a portion of the proceeds is going to go toward a cancer patient in their time of need right now. So we really appreciate your support and everything. Get it out there, and I'm going to start my video. So I explained in my last video about getting tested for the BRCA gene that I had talked to my gynecologist, and people kind of look at me. I'm 25 years old. I don't have kids. I'm getting married next year. So I have a lot going on in my life that is ahead of me right now. So getting this surgery, they were kind of looking at me like, what? What do you want to do? So when basically my thought process was, I explained to you guys about my mom and what I saw her go through, and my goal is to prevent myself from getting cancer. No, I do not have cancer now. I just want to make that clear. I did not test positive for cancer. I am a carrier of the gene, which makes me at high risk of getting cancer in my lifetime. So the doctor did tell me that without this surgery, my chances of getting breast or ovarian cancer is 70%. When I do get this surgery, it goes down to 1%. I think that's a pretty good deal. Yes, it comes, there are other options that decreases your chances as well, but from 70 to 1%, that is a huge drop, huge drop. My first option that they really suggested to me was that was the least invasive, which is obviously observation. I would go for an MRI of my breasts to make sure nothing really pops up. And I do have to go for pelvic ultrasounds every 6 months just to monitor my ovaries to make sure there's no signs of cancer, basically for the rest of my life, which I'm okay with that. If I can catch it early, that's fine. But I am going to be going for my ultrasounds, but the reason why I chose this surgery is that I have more than half a chance of getting cancer. Why am I going to give cancer a chance? Like, why would I sit back and I can monitor myself? That's fine. There's no reason why that's not a good option. But in my head, it's like, why give it a chance to show up in the first place? I don't want it there. So if I have to get this surgery, it removes all the tissue. So it doesn't even give cancer a chance to even grow. God forbid, now this is my thought. Let's say I went for observation. I would go every 6 months. You know, cancer does start as tiny, minute cells that you probably can't even see on a scan until they're all crumpled up in a group and they cause a mass or a tumor. And by then you're stage 1 or stage 2, stage 3, and in worst case, stage 4. You don't know until that scan can pick it up. You don't even know if the scan, if it will pick it up at all and something's there. That scares me. It really does. So that's why I was like, nope, I'm not going to do that. Because once the cancer's in my body, the doctor said I'm going to have to get the surgery anyways to remove it. I was going to have to maybe go for a radiation, and I would definitely have to go for chemotherapy. I am not doing that if I don't have to. If I can decrease my chances from 70 to 1% by just taking everything out, then so be it. I'm going to do that. You know, I get mad because it's like, oh, just cancer really sucks and I hate it. I really do. And I don't want to give it a chance to even grow in my body. So that's why I'm like, nope, take them out, take all the tissue out. Yes, I know I still have a 1% chance of getting cancer, but that's a hell of a lot better than 70%. And there are some risks that come with getting the surgery, as far as having kids. If I get the surgery, I am not going to be able to breastfeed because they take out the tissue, they take out the nerves, so I'm not going to have any feeling, and I'm not going to have any milk ducts to produce milk when I'm pregnant, so I can't breastfeed. And that's something to think about, a decision that you personally have to make. Me, I rather not breastfeed than have cancer. That's how I look at it. I want to minimize the risk that I have of cancer as much as I can. And that's basically why I chose to have this surgery, because I loathe cancer. I hate it. I've seen it, what it does to people, and, you know, just because I have the gene doesn't mean I'm going to get cancer. I probably won't even get cancer even if I don't do anything. It's not 100%, deal that I'm going to get it. It's not 100% chance. Just because I have the gene, I might not even have cancer at all. And they said you can look at it another way. Well, yeah, you have 70% chance of getting cancer, but you also have a 30% chance that you won't. So people look at it differently. People, like I said, have their own opinions, but this is my thought process. This is, what was going through my head this whole time. So I see what it does. It sucks. I hate it. It's not going to have a chance with me. Like I said before, I'm putting my foot down. I'm staying strong. And if I have to go through this, then so be it. So, it's all, like I said, positive thoughts. You have to get mad at it. Whatever happens, happens. If I do end up getting cancer in the long run, I have no control over that. But I know I did everything in my power to prevent myself from getting it. And there are other options out there that I could take if I do get it. So you kind of have to mentally prepare yourself either way, because there's no 100% guarantee that I'm not going to get cancer just because I'm having the surgery. But it's a hell of a lot lower risk than if I don't. So that's my main reason why I'm getting this surgery, is to decrease my chances and to not give cancer a chance at all. Nope, not gonna happen. So I am gonna do another video about what I experienced when I did end up going to the plastic surgeon, what kind of you can expect when you go for your appointment, and kind of go from there. So again, thank you for all your support, and I hope that this video, I didn't want to make it too long, but these are my feelings about why I'm doing this and why I want other women to know that it's okay. Just because you hear the word cancer or high risk of cancer, you do not have to run scared. We can fight this. We are in this together, and I want other people to know that. Don't run scared. It's a scary thing, but we can't give it a chance. We cannot. We cannot. So, thank you guys for listening. Thank you guys for being so supportive. I kind of get in the zone when I talk about this stuff because I just feel so strongly about it. And keep sharing the t-shirt video. I am going to put the link to it for this video, or for the t-shirt video in this video, down in the comment section below. So thank you guys. I love you, and my next video will be coming soon. Bye guys.